Do you have chronic pain? Have you been trying to find relief with surgeries or medicines or injections with no luck? Then laser therapy might just be the answer for you. Dr. James Dalfino of Connecticut Disc and Laser Therapy Centers is back with us today. Hi, doctor.
Hi, how are you?
I'm good, thank you. So we're talking about finding relief without going under the knife.
Correct. Connecticut Disc and Laser Therapy Centers is fundamental for the treatment of chronic conditions, debilitating conditions that don't seem to respond to typical conventional treatments like physical therapy, medications, injections, and even surgery. So what we do is we actually have technology that's been around for quite a long time, but it is actually getting patients who may be suffering from a sprain or strain yesterday or chronic pain for 20 or 30 years, arthritis, and we're getting them healed, we're getting them healthy again where they've been failing from other therapies.
And this machine has something to do with it, doesn't it?
It does. This is called the Light Cure Laser. Light Cure Laser has been around for about 12 or 15 years. The president of the company is actually a Connecticut resident, Dr. Brian Pryor from Waterbury. And what the laser does is we actually have the ability to target specific conditions like herniated discs, spinal stenosis, arthritis of the spine, knee pain, knee arthritis, carpal tunnel. And the beauty part is it actually works by targeting those areas, and when we shine laser light over areas that we want to target, the tissues absorb that laser light in such a way as to decrease inflammation, swelling, and pain.
And we're watching that right now on the screen, and there's a demonstration going on.
Yeah, and by doing so, it actually helps improve the circulation to the area as well. So not only are we healing the tissues, but we're actually helping improving the circulation so that the body has the ability to help heal on its own.
Now, is this procedure for everyone or anyone?
The majority of patients out there that are suffering from different chronic conditions, it is going to work for them. There's probably about an 85 to 95% patient improvement rate. And the beauty part is that depending on what a patient's coming in with, whether it be a spinal issue, whether it be a problem with their arms, their legs, a shoulder, a knee, we can actually target and implement all the different therapies into the system. If we take a look at the screen for a moment, we can actually see that there's a body image there, and we have the ability to actually put and choose specific pathological conditions. And there's well over 30 to 40 that are actually pre-programmed into the system. So if I wanted to do arthritis of a hand, I can actually program that in there, and I can actually continue on. And then once the therapy actually starts, we actually run the laser probe over that region. It's painless, there's no downtime, no side effects, no contraindications from laser therapy. It's been around for well over 30 years, and there's about 6,000 or 7,000 documented studies on its effectiveness.
Well, why doesn't everyone try this out before they do surgery?
Well, they should, but the problem is that the conventional approach is to try a specific plan of physical therapy, and if that fails, to try injections or medications, and if those fail, then unfortunately a patient is subjected to surgical intervention. And then when that doesn't work, unfortunately the conventional approach says, well, there's nothing else we can do. You can do pain management, and you kind of almost got to live with it. Now we're telling patients, you don't have to live with it anymore. We actually have a way that's actually going to help heal those tissues and get those people's, back in shape again with their conditions.
Now, is this instant relief, or does this take several treatments? What's the procedure?
Sure. Obviously, we need to do a full evaluation with a patient to be able to understand what their needs are, how chronic their case is, if it's a slip and fall that they might have had a week ago, or they've been suffering with arthritis for 20 or 30 years. But in a general consensus, anywhere between, on a case that has just started, a relatively new injury, 2 to 4 weeks of care. If it's more of a chronic case that's been going on for quite a while, maybe 6 to 8 weeks of care.
Now, doctor, just explain to our viewers how you could target really any part of the body with this instrument.
Sure. Again, what we do is we actually, depending on the situation or the actual pain that we want to address, the laser has the ability for us to target the specific body areas. Like, for instance, here's a spine, and I choose disc herniation. And then from here, we actually have the treatment protocols all set right into the system. And when we actually do the therapy, it's actually it's a nice warm touch and we actually go right over those areas, and again, the tissues absorb that laser light, and it actually decreases inflammation, swelling, and pain, and it actually promotes healing.
Now, I just want to bring up quickly, we saw something like this on Good Morning America a couple weeks ago, and you were using not you, but doctors were using this on animals.
Absolutely. In fact, George Stephanopoulos had a segment on the show, and they were actually using the light cure laser for animals. There's two versions. There's one for humans and one for animals.
That's great.
And the response is absolutely revolutionary.
Oh, I'm happy to hear that. All right, we have to mention that your center is offering viewers a free evaluation. Yep. As always, I see, right?
Absolutely. Connecticut residents that want to call in, we'll give them a free evaluation to see if laser therapy might be an option for them.
All right, and all the information that's there on your screen, also ctdisccenters.com.
Yep.
Is that correct? Very good, doctor. Thank you so much for being here. More on WTNH.com, of course. Stay with